Hi everyone, this is Rose and Meryl Pile, and I'm going to share with you questions with answer that you can use to your upcoming NC2 Caregiving Assessment. So let's start. So question number 1. So will the memory loss of someone with Alzheimer's come back? So you can answer through atrophy or a shrinking of an organ or tissue occurs in the brain of Alzheimer's patients. You can also add those memories. You can also add your answer that those memories may still be present in Alzheimer's patients, but they struggle to retrieve them. So let's proceed to question number 2. So give safety precautions for bathroom to avoid falls and accidents of the elderly. So you can answer to these questions like hard rails washroom consistently keep the floor dry and not wet. So you can add also to your answer that you can remove the throw rug, keep the top dry and clean, install grab bars or rails, illuminate it, raise your toilet seat, and select a seat for the bathtub or shower. So, question number 3. Difference between dementia, Alzheimer's, and amnesia. So, you can answer amnesia is the loss of memories, including facts, information, and experiences, whereas dementia is characterized by a general loss of higher brain function. And Alzheimer's disease is it only affects the memory. So let's proceed to question number 4. So how do you properly feed the baby? So the answer to this question is through bottle feeding at a steady pace. So question number 5. How to properly shake feeding bottle? So you can answer like gently swirl the bottle before shaking it. Question number 6. What is the machine that is used in housekeeping? So the answer in this question is vacuum cleaner. So you can also add your answer that it comes with a hose, a suction motor that fits inside the case, and a variety of attachments for both delicate and tough cleaning tasks. So let's proceed to number 7. So how do you sweep the floor? So the answer to this question is beginning in the corner, sweep quickly and smoothly toward you. So let's proceed to question number 8. So how do you use vacuum cleaner properly? So the answer to this question is, first you have to get rid of the large particles. Use a duster to dust your furniture. Clear the way for your vacuum. Check to see if the bag is full. Use the recommended nozzle for best results. Slowly vacuum the area and empty the bag if necessary. So question number 9. First aid for infant convulsion. So the answer to this question is through ice pack. So remove any objects that may be in the way and gently place your child on the ground on the floor to prevent your child from choking on saliva or spitting. So lie your child on his or her side. Clear your child's mouth gently with your finger if they vomit, and remove any clothing that is tied around the head or the neck. So question number 10. So what are the stages of the baby? So the stages of the baby is infant 0 to 3 months, to toddler 0 to 3 years, preschooler 3 to 4 years, and school age 4 to 5 years. So question number 11. So stages of washing. What is the stages of washing? So the answer to this question is Washing usually with detergents or other chemicals in the water. Agitation, rinsing, drying, pressing or ironing, and folding are all parts of the laundry process. So, question number 12. How do you iron properly the clothes using water? So the answer to this question is fabric softener. So the fixings and cleansers are kept onto textures filaments to assist with battling wrinkles, decrease static, and add a delicate touch and new fragrance to your clothing. So that's it. Question number 13. So why do we need to segregate the linen? So the answer to this question is to stop strong or dark colors for bleeding onto white or lighter colored items. So question number 14. How do you know if the linen is fading? So the answer to this question is wet aside of the textures. It allows you to dose into the textures for a couple of minutes and wipe with a white material or paper towel. So question number 15. What are the parts of the refrigerator? So the parts of the refrigerator is the superworking pieces of a cooler, incorporate a blower, a condenser, an evaporator, an extension bulb, and a refrigerant. So question number 16. How do you preserve leftover food? So the answer to this question is put in a tightly sealed container and store in a refrigerator to keep the bacteria out. Cover extras and close them by the water or airproof bundling or seal them away compartments. So question number 17. Skills that focus only on the pulse and breathing. So the answer to this question is the recovery position. Keep the that's it. So question number 18. So how do you treat a bullying child? So the answer to this question is keep the lines of communication open, use positive body language, boost the child's confidence, and praise their progress. So question number 19. Difference between unoccupied, open, and closed bed making. So the answer to this question is the open is half the half sheet. The open is the half the top sheet is closed with an expecting patient. The other half is closed with no expected patient. The patient can easily get back into the bed by opening the bed with the top covers folded back. And the closed bed, the top sheet, blankets, and bedspreads are pulled up to the top of the mattress and are hidden under the pillow. This is ready in a clinic room before another client is owned up to the room. So, number 20. What is the step-by-step process in washing clothes? So you can answer this question like, step 1 is care instructions can be found on the clothing tag. So step 2, sort your clothing. Step 3, select the right settings. Step 4, add cleanser, conditioners, and promoters. Step 5, turn on your washer after you have loaded it with clothes. And that's it. So question number 21, how do you soak the linen? So the answer to this question is, get rid of the dirt, put the fabric in the tub and cover it with lukewarm water for 4 to 5 hours. And that's it. So question number 22, what is the principle of cleaning? So the answer to this question is, you may answer, there are 2 fundamental administrators in all cleaning. So pH and actual expulsion. So one of the most effective methods for microbial decontamination is physical removal. So it removes food sources that aid in their growth and reduces the number of pathogens on all surfaces. So question number 23. What is the count of CPR, or the cardiopulmonary resuscitation? So the answer to this question is 5 cycles, 30 compressions, 2 VM or ventilatory maneuvers, and 1 LLF. So question number 24. So question number 24. Where's the vegetable placed in the refrigerator? So the answer to this question is in the crisper. The majority of vegetables, including celery, potatoes, carrots, broccoli, and potatoes, should be stored in the crisper of your refrigerator in a plastic bag or container. The best way to store mushroom is in a paper bag. Fruit should be stored in a different area of the refrigerator than vegetables. So, let's now proceed on our part 2. So, I will be going to comply some of the questions for our part 2. So stay tuned for more, and please subscribe for the Journey Abroad YouTube channel by clicking the subscribe button, and see you there on the part 2 of our NC2 questions and answers. So thank you for watching, and God bless us all. Bye!